Wetlabs really helps us achieve our goal of reaching as many cats and dogs and improving their overall health by, not only seeing cats and dogs here, but also educating veterinarians and veterinary support staff on dentistry so that we can reach even more cats and dogs by helping those general practitioners really practice better dentistry. Learn how to do better dental x-rays. So not only getting a better image, a really clear, good image of each tooth, but also how to increase efficiency because these dogs and cats are under anesthesia. So we really want to help them get those x-rays accurately and efficiently so that they can get them out of anesthesia quicker. In veterinary medicine, we don't really get a lot of dentistry education in veterinary school, and so it's really great to provide these veterinarians education on how to do extractions better, not only with less discomfort for the animal, but also, again, more efficiently so that we can get these animals under anesthesia. And again, more light bulbs went off, and it was great to see them really see how to do these with less effort and much quicker. We generally have these wet labs in the spring and fall so that we don't have to be here. We don't want people here when it's nice and sunny outside, so we do them in the spring and fall. So check out our website for more information.
Hi there, Dr. Keaten from Mainely Veterinary Dentistry, and I wanted to highlight how helpful this cone beam CT machine is for trauma and fracture cases. This is a 2-year-old lab that hit a telephone pole at 60 miles an hour. So significant trauma to his face and his jaw. So he came to us after being stabilized at the emergency clinic and having some initial diagnostics done. They got him nice and stable and able to go home with the owners to then be referred here for repair. So this is his CT here about a week after the event. So you can tell he's got some significant fractures to his maxilla, so the top jaw, a lot of broken teeth in here, and then another fracture here in the mandible. So these fractures were pretty stable because there's a lot of bone, attached bone that stabilizes these fractures. But down here in the mandible, this was very mobile. His jaw was mobile, and so we needed to stabilize this so that it could heal. So we placed a wire along all these teeth and some acrylic to really keep that jaw from moving around so that we could get a bony callus here. And then had him come back six weeks later for the wire removal and also to get all these teeth out of here once the fractures were healed. So we've got a couple fractures here, a couple fractures here on the bottom, and then over here we even have a fracture in the maxilla. So we got him in for treatment, and as we mentioned, we placed wire and acrylic, and then we had him come back 6 weeks later. So this is his 6-week post-treatment CT, and you can see this is the acrylic that we eventually removed after we took this image. But his fractures are nice and healed here, nice callus. You can't even tell there was a fracture over here. These fractures are nice and healed. So we were, rest assured that we could get this device out of here, that his fractures were healed and nice and stable. So we removed this acrylic, removed all these fractured teeth now that we were sure that the bone wasn't going to come with those teeth. Had some fractured teeth down here and some dead teeth we needed to treat. And happy to report that Hunter is doing great and will hopefully live a long, happy life. If you want more information about our cone beam CT, you can go to our website at mainlyvetdentistry.com. Hi there, Dr. Keaten from Mainely Veterinary Dentistry. And today I wanted to talk a bit about recognizing fractured carnassials in our canine patients. This is a really common problem that we see on oral exam here because unfortunately a lot of people think that antlers and bones and hard things are good for dogs to chew on, but unfortunately it also breaks teeth. It removes tartar, but it removes enamel and tooth with it. So it's really common for us to see broken carnasials on oral exam. And sometimes it can be hard to recognize because after the tooth is fractured, tartar can build up on that tooth to hide the fracture. So one way to kind of recognize this is one, making sure we're doing a full oral exam on all of our patients because that carnasial tooth is pretty far back in the mouth. So we need to really pull those cheeks back. And if you need to utilize the owner to help you do that, go for it. But, bringing that cheek all the way back to the carnasial because it's so common that this tooth is broken, but also just recognizing what the normal shape of the tooth looks like. So this is a model. So this is, perfectly healthy carnasial. This is what it looks like. And so when there's a slab fracture, it can often change the shape of this tooth. So becoming familiar with what this tooth looks like, even looking for little chip fractures off the bottom, because if the enamel is missing, the dentin is exposed and an infection can still get into that tooth even if the pulp is not exposed. So even little tiny fractures, we can bond those here to protect the tooth from becoming infected. So just encouraging, those full oral exams on every canine patient, really checking out those carnasials and being familiar with what it looks like. So this is the normal shape of a carnasial. Become familiar with it. We have lots more videos on our website at mainlyvetdentistry.com.
Hi there, I'm Dr. Jennifer Keaten from Mainely Veterinary Dentistry, and this is Maureen, one of the technicians here, and this is Bubbies, and he's here to help us demonstrate how to do a thorough oral exam on a dog. So what I usually do is I start with checking the bite, and we're looking to make sure that in the front, the incisors, the jaw length is the same, and that the upper incisors are just slightly over the lower incisors and kind of interdigitate like this. And then we're also checking the bite on the sides to make sure that the upper maxillary teeth are just outside of the lower mandibular teeth. Additionally, as we're looking through, we're looking for spots of gingivitis, calculus, plaque, to indicate where we're at with our oral health. So we'll demonstrate that on Brutus now. So first we're going to look at the bite. So we're going to start with the front, and we're looking with the mouth closed where the incisors fall. And he does have a little bit of an underbite, typical for those brachycephalic breeds. And now we're going to look here on the sides and make sure that those upper teeth kind of fall on the outside, especially our carnasial tooth falls on the outside of the mandibular teeth. And then we're looking for plaque, tartar, gingivitis, and all that looks good here because Bubbies gets regular cohats every year. Then we'll look at the other side. And again, our carnasial upper maxillary fourth premolar is outside of our lower molar, so normal bite. Minimal plaque and tartar, no gingivitis. He is missing a few teeth, so missing teeth are definitely important to note. And if a dog is missing a tooth and hasn't had dental x-rays, that's something that should be checked. And then the last thing I do is, if the pet will allow, just look in the back of the mouth, make sure the palate, the back of the oral cavity looks good. Just checking for any masses or problems back there. So that's how to do a proper oral exam on a dog, which should be done at every exam, at least annually, if not biannually. For more information, you can go to our website at mainlyvetdentistry.com.
Hi there, Dr. Keaten from Mainely Veterinary Dentistry, and I wanted to talk to you about a recent case we saw here that really highlights the importance of preventive dentistry in our young patients. So this was a 2-year-old Shih Tzu that came in because it had a displaced incisor from trauma, and so that's what we were coming in for treatment for. So, but it was a great thing that these owners recognized this problem at a young age in this dog, because what the owners weren't aware of is that at 2 years of age, Shih Tzus and little breed dogs like Shih Tzus can develop periodontal disease at a very young age. So once we got imaging on this dog, not only did he have the displaced incisor problem, but he had already developed periodontal disease and bone loss around some of his teeth due to crowding. So we had to treat some other problems in this mouth. But thankfully we got on top of it early and hopefully can keep, the teeth in this dog's mouth healthy for a lot longer. So great example of why preventive dentistry is such a great thing, and be thinking about bringing in those dogs, 18 to 24 months for their first cleaning and assessment. For more information, you can go to our website at mainlyvetdentistry.com.